Hello. Today we're going to talk about the epidemiology and control of HIV in Brazil. It's an overview of the progress, challenges, and future directions. Brazil is a country overview, has a population of 212.5 million, that represents 2.59% of the world population. It is considered to be an upper middle income nation with regional inequalities. The life expectancy is 76.3 years old. Unemployment rate is on the house of 7%. Annual inflation of 5.53%. Brazil has a universal public health access free for all, and Brazil alone accounts for 45% of HIV cases in Latin America. This is a comparison table that shows estimates, of Brazil comparing with the Latin America, Colombia, and Argentina. Brazil has a population of 216 million. The Latin America has a population of 624. Colombia has a population of 50 million and Argentina of 45 million. When we talk about people living with HIV, Latin America has a population of 2.3 million people. Brazil has more than 1 million people living with HIV. Colombia has 230,000 people living with HIV. And Argentina has 140,000 people living with HIV. In regards of the new infections rates, the Latin America has 120,000 people with new infections every year. Brazil has 51,000 people with new infections every year. Colombia has 1,300 people living with HIV every year, and Argentina, 4,200 people living with HIV. In regards of deaths, Latin America accounts for 30,000 people that die every year of HIV. Brazil has 14,000 people. Colombia, 3,700 people. And Argentina, 1,400 people. This is data from the UNAIDS of 2023. The history of HIV in Brazil is as follows. The first case was seen in 1980, but the first official case was only announced in 1983. Initially, it was seen as a foreign disease concentrated in the gay population in metropolitan areas such as here in São Paulo. But then it is spread to heterosexuals and key populations such as men with having sex with men, drug users, and sex workers. In 1986, there was a blood scandal which contaminated people with hemophilia because of the blood of the hospitals being contaminated, and only worsened the public trust on the government dealing with the HIV in Brazil. The surveillance and data collection is done by the CNAN, which is accounted for the National Notifiable Disease Infection, which is mandatory national reporting system of new infections, new diagnosis, and is collected and analyzed by the Ministry of Health. The DCCI, which accounts for Department of Diseases of Control Conditions and Sexually Transmitted Infections. They are responsible for implementation, guidelines, strategies, manage policies, and prevention. Also, there is an annual epidemiological bulletin that is done by the Ministry of Health every year, and it accounts with data about HIV in Brazil, of new cases, incidence, prevalence, mortality rates in all group ages, and access to treatment. The epidemiological data of 2024 says that there are an estimated of 1.12 million people living with HIV in Brazil ever since 1980 through 2024. The annual infection is around 40,000 a year. The deaths, it's 1,100. Mortality is it's 4.1% per 1,000 population, and ART treatment coverage accounts for 81% of the population. The demographic trends says that 70.5% of the cases are in men, then ages between 25 and 34 years old have 39% of people affected. Among the young population between 15 and 24, 23.4 is affected with HIV. Men having sex with men accounts for 52.6% of the male cases. 3.2% of the cases are in Black and Pardo populations. And vertical transmission, which is from mother to child, accounts for 166,000 HIV pregnant women notified between 2000 and 2024. This is a little map that I created in regards of the regional HIV distribution. Brazil accounts for 5 regions: the South, the Northeast, Northwest, Northeast, Southeast, South, Central West, and North. The Southeast and the South represent 70% of all cases of HIV. This data is from 2019 to 2023. The annual coverage for those areas is the South accounts for 6.5 thousand cases, Southeast 13.2 thousand, the North 4.7 thousand, Northeast 8.6 thousand, and the Central West 3,000. The transmission mode of HIV in Brazil is mainly through sex. So men having sex with men account for 62.6%, women for 86.4% via heterosexual contact. There are also a vertical transmission from mother to child and between key populations, which accounts for men having sex with men, trans women, and sex workers and prisoners. Prevention strategies from the past and the present is as follow. Brazil was a pioneer in offering free ART treatment back in 1996 via the SUS system, which was free for everybody. There was a massive condom distribution in 2000, accounting for an annual campaign made in Brazil. In 2013, there was the test and treat, which is accounted for providing treatment on patients not taking into consideration the CD4 count or viral load. On 2017, they started the preventive prophylaxis treatment coverage. In 2018, there was a collaboration between countries like Brazil, Mexico, and Peru, which was called IMPREP, offering oral medication for patients ever since the first day of diagnosis and consultation. In 2023, 81% of people living in Brazil had access to ART treatments. Brazil versus Latin America on the global goal of 95, 95, 95, which is, we can see that it's undetectable, untransmissible. So Brazil has 91% of their population diagnosed, 81% on ART treatment, 95% of the population is virally suppressed. And when we compare to the Latin America, 89% of the population is diagnosed, 73% is on treatment of ART, and only 67% of the people are virally suppressed. So this shows that Brazil is on the right direction to reach the global goals of 95, 95, 95. Barriers to control is still a working process in Brazil. Stigma represents 52.9% on report of discrimination against HIV. 68.2 have problems of mental health. Brazil passed a law in 2014 which criminalized discrimination against people with HIV. Brazil is right now on the conservative ship and was reduced support on HIV programs. And the youth are vulnerable with the poor education program in the nation as for now. In regards of the geographic disparities, the South receives more attention and has more resources than the North, which is more neglected and has limited access to care. So the proposed strategy that I created for Brazil is to build a program on a mobile unit, which will account to offer HIV rapid test, PrEP distribution, and educational material. It will focus on underserved regions and indigenous population. We're going to collaborate with partnership with NGOs and offer a bilingual program in Portuguese and native Brazilian language in the Indian communities. Also offering counseling, self-test kits, and telemedicine follow-ups. The expected outcome for this is early detection in remote areas, high pre-op uptake, lower the stigma, and greater access to equality to tackle the geographic inequalities. The conclusion is that Brazil leads HIV control, but it's a working process. Need to continue its supports for the population and create innovation and equality to guarantee success. Thank you so much. My name is Isabel Cruz. I am in the first year of the Master in Public Health in FIU, and this is the HIV demographic epidemiology class. Thank you.